Welcome back to the Pelvic Health Summit. I'm here with Dr. Elizabeth Poynor. She is a gynecologic surgeon. She specializes in complex and consultative gynecology. She also treats hormone-related issues, pelvic health issues, and cancers. And she treats her patients at her practice on the Upper East Side of Manhattan. Thank you so much for being here.
Thank you for having me.
So will you tell us a little bit more about your practice and approach?
Well, we have a holistic approach towards women's health. We're able to manage women's health problems both medically and surgically. And we try to treat the whole person, the whole body, and realize that we're actually treating a person and not a disease or a problem, but we're treating the whole person.
Fabulous. And can you tell us a little bit about what the patient experience is like? What can they expect when they come to see you?
Hopefully it's a pleasant experience and productive and with excellent outcomes. We're an outcomes-driven practice, and if you come to us with a problem or an issue, we want to make sure that you get a solution to that problem or issue in a kind fashion and a tranquil and hopefully Zen-like type of atmosphere, actually, in a healing atmosphere.
Yes, we're all about Zen and healing. It really makes a big difference for the patient experience. So can you tell us a little bit about the conditions that you treat and see in your practice?
We treat a variety of women's health issues and concerns. We treat a lot of concerns related to pelvic health in terms of helping to discover the cause of pelvic pain and manage pelvic pain. We treat surgical issues related to women's gynecologic conditions and also difficult hormonal problems that women may have, both in younger women and in older women. We also perform a significant amount of complex gynecologic surgery. We perform surgeries related to fibroids, ovarian cyst, endometriosis, and other even cancerous conditions in the practice. So we have a holistic approach, both medical and surgical, and we have patients who come to us for medical gynecologic issues and also surgical gynecologic issues.
So what are some of the typical treatment protocols that you put in place for your patients?
We try to always have a holistic protocol. I keep using that word a lot, but it rings true to what we try to do in the practice. So that when we have protocols in helping women with problems, we look at the whole body. We look at the mind, we look at psychologic issues, healthy mindfulness in managing health, along with a lot of stress management. And we also then look at the more hardcore issues in terms of what's actually going on physiologically. But we always, when we put a protocol together, we always want to work with mind, body, spirit. We don't look at problems in isolation, actually. So our protocols usually always include a mind, body, spirit approach.
That's great. We've been talking a lot about that during this summit. What are some common myths that patients have come in with that you can kind of debunk for us if we also hold those myths?
Well, I think that unfortunately one of the common myths with pelvic pain especially and with women's pelvic issues, I still have women coming to me saying, doctor told me it's all in my head and there's no solution, and that maybe for urinary issues I need to take more antibiotics. So one of the myths I think that we have is that these problems are very difficult to solve, so some people don't try to solve them. So that's unfortunately still perpetuated, actually, that many pelvic pain issues are psychologic, and they're actually not. Many of them have a very large physiologic component to them, endometriosis specifically. But those myths are still out there in the medical world.
Definitely. Let's get a little bit more specific. Can you break down a little bit about how hormones can interplay with some of the conditions that you see?
Well, hormones hormones affect many aspects of women's health, and we're actually now beginning to define that. We are only scratching the surface of women's hormonal health, actually, and so we are answering those questions and investigating those questions and actually formulating those questions right now, because it's an area of medicine that has not been really paid attention to. We've looked at hormonal health largely related to menopause, when women start to lose their estrogen, but we're now looking at hormonal health in younger women also. So hormonal health is very important in looking at issues such as polycystic ovarian syndrome, endometriosis, premenstrual, mood disorder, so that we begin to look at these areas and begin to focus in on them. How can we manage the balance of estrogen and progesterone? We also look at androgens now too. Androgens such as testosterone and DHEA sulfate have been largely ignored in women's health, and we're now beginning to really look at those areas.
Definitely. What are some of the treatments that can address the hormone imbalances, and where does the pill come into play in this conversation?
There are two approaches when you look at hormonal health, actually three, that we look at. We look at nutritional approaches and lifestyle approaches, which are really important. And again, we're beginning to define that, limiting estrogen exposures in the environment. There are compounds called xenoestrogens, which are parabens, BPAs. Parabens come from preservatives in our skincare products. BPAs come from plastic bottles. Pesticides are also a form of xenoestrogens, so we can look at how we can change our lifestyle to support better hormonal balance. Lifestyle also includes mindfulness, looking at the hypothalamic pituitary axis, which is the area of our body and how it functions and how we interpret what goes on in the outside world and how we process it to our inner body. The HPA axis, when stressed, cortisol production goes up, and that may cause other imbalances of progesterone and estrogen when we don't manage stress appropriately or effectively. So again, that is a lifestyle approach to hormonal balance. We also use nutritional approaches in our practice. We want to focus on getting in good, healthy estrogens and phytoestrogens from our food. We also want to consume foods that help us to process our estrogens better, such as cruciferous vegetables like broccoli and cauliflower. We then look at more, I call it medicinal approaches light, and then there's medicinal approaches heavy. Medicinal approaches light may be something like natural progesterone for a woman who has endometriosis or polycystic ovary syndrome to actually balance a natural estrogen dominance. And then if we look at medicinal heavy, then we begin to look at products that may come from your pharmacy, such as birth control pills and such. You asked me where birth control pills and oral contraceptives come into the management of hormonal balance. I think that is going to be a little bit of preference of a woman. Some women want to have more natural approaches to their health, and we're certainly able to work with them with those approaches. And then other women may want to use a birth control and prefer to use a birth control pill because that's what has been largely used to manage women's hormonal balance. But as we get information about birth control pills, they're synthetic hormones. We also know that the risk of breast cancer is elevated with the use of the progestins in birth control pills. So a lot of our patients who may be at elevated risk to develop breast cancer or other cancers will try to avoid them. The good news about birth control pills, and as a GYN oncologist, I need to add, is that they actually help to prevent ovarian cancer, though. After 6 years of use, you decrease your risk of developing ovarian cancer by 60% across your lifetime. So there's good aspects of birth control pills. But in our population of women that we treat, and the women we treat now, want to move more away from those synthetic hormones and want to move more into more natural types of treatments.
Thank you. Super informative. There's a lot there. In terms of getting started for people at home who want to look into how to find that balance if they can't come to you in the city, what would some good questions be for their gynecologist around partnering that lifestyle nutrition approach with the heavy and light medical approach?
I think, in our practice, we like to have everything under one roof, so to speak. We like to help to manage the nutritional approaches and the more natural approaches. But women, I think that there is a great intersection now, and this is actually a really great time in medicine, that we're realizing that there are really great things that have come out of allopathic medicine or traditional medicine, but there's also a lot of great things that can come out of naturopathic medicine, and we can have an intersection of science, technology, nature, and allopathic medicine, along with more natural types of medicine. So a woman may want to ask and look in her community, would her allopathic OBGYN be willing to partner with a naturopath allopathic individual in order to maybe come to a good in-between ground that would solve issues and problems and solve the goals of a woman that she may have in terms of how much she wants to use more natural approaches as opposed to more allopathic or more medicinal approaches to her health.
Thank you for breaking that down. Let's talk a little bit more about cancer. What are the most common cancers that you're treating?
Well, in our practice, my focus is on gynecologic malignancies. So we have a large number of uterine cancers that we treat, which is the most common gynecologic malignancy that a woman will develop. And that actually has a hormonal basis, a nutritional and lifestyle basis, because women who are overweight have a higher risk of developing endometrial cancer. So it's a natural transition in our practice to begin to manage lifestyle and to help women to manage their lifestyle with endometrial cancer. We, of course, treat, unfortunately, ovarian cancers. Cervical cancer is not so common. We treat a lot of pre-invasive disease of the cervix, abnormal pap smears perhaps, and cervical dysplasias. But by far the most common cancer that we treat in the practice is uterine cancer.
Thank you. And can you talk a little bit about the symptoms associated with those? I know that when someone's experiencing pelvic pain and they're not quite sure what it is yet, it can be a very stressful time.
Well, that's a great question, and that's actually, as having a cancer background and a cancer surgery background as training, that's how I actually became involved with helping to manage pelvic pain and helping to find the cause of a woman's pelvic pain, because of course that's always the question, is it cancer? So people would be sent to us and to our practice to say, is it cancer causing this pain? And we would, most of the time say, no, it's not a malignancy. It's always important to think or to rule out. And then we would have patients who would not have an answer to their pain. And that's how we became involved in helping to manage pelvic pain, because they would come to us, we'd say, no, it's not cancer. And then, but they would say, but what is it? And so we had to go further because their gynecologist had sent them to us. But always with pain, in a woman's pelvic pain, we should always make sure that there's not a malignancy which is present. Other signs and symptoms which always should be paid attention to are abnormal bleeding, bleeding between periods, heavy periods. Actually, and very subtle symptoms that a woman may have also are very important, such as pelvic cramping, urinary frequency. These may be early symptoms of ovarian cancers or gynecologic cancers. Fatigue is a really big symptom that we always have to pay attention to. It's a symptom that we ignore with cancer, and universally when I speak to my patients who have an early cancer that we diagnose a cancer in, people will always tell me, I don't feel right. My energy level is off. I just don't feel right. And that's a very subtle symptom that we always have to pay attention to, actually, as clinicians, to really find a reason or a cause. And that fatigue may just be stress or stressful lifestyle, but we always have to make sure that something more significant is not going on.
That's great. It's so, I think, therapeutic to hear about how you really listen and validate your patients and their experience and work with them to find out what's going on. For those who do come in with pelvic pain, who you've ruled out cancer for, can you tell us a little bit about how you work with them?
Again, we have the mind-body-spirit approach. We look at stress management. We start from the head all the way down. We look at are there new stressors in somebody's life which may be throwing their hormone levels off, which may actually be leading to inflammation also. So if we look at what's going on in the outside world, it can affect our body through changing our hormone levels through cortisol. It can affect our body through changing our immune system, through suppressing our immune system. It can change our body through initiating cascades of chronic inflammation. So we always try to take a good history, and that sounds so clinical, but we try to speak with our patients about what is going on in their life, their personal life, their work life. So looking beyond just your height, weight, your blood pressure, your BMI, we really start with, how are you feeling, what's going on in your life. We then begin to look at imaging. We do a lot of imaging in the practice. What does the uterus look like? What do the ovaries look like? Is there an ovarian cyst? Is there any endometriosis that we can see in the ovaries or in the pelvis? Is there any adenomyosis, which is endometriosis of the wall of the uterus, because that can give us some clue also to what is going on. We then look at bladder function, and it's always important to remember in the pelvis is their musculoskeletal structures, the levator muscles, the skeletal structures in the pelvis. Anteriorly, there's the bladder, then there's the uterus and the ovaries and the rectum. So we try to go through each of those structures and talk to our patients about what symptoms that they may be having and what types of evaluation that they've had. Because generally, if you do listen, your patients will eventually tell you which direction to go in. We then will initiate what the next step should be. Should it be referral to a urologist? Should somebody have a cystoscopy? Do they have interstitial cystitis? We try to work, in a logical fashion from what's going on in the outside world to now what's going on in the body. And we work from anterior to posterior and the pelvic floor. So bladder, uterus, ovaries, rectum, levators, skeletal structures. And so these are how we begin to put a story together to try to get an answer to how to help somebody.
Really cool. I think that word holistic keeps coming up, and I think that within this conversation, the mind-body food stuff is part of the holistic, but breaking down all of the different structures that are associated with the pelvis was really helpful in seeing how you look at those structures in a holistic way. So that was really interesting. Can you please tell us about some of the supplements to the treatment protocols, home remedies, things that patients can at home start doing that can help?
So I think that, again, that taps into good, healthy nutrition. We actually put together a nutrition guide for our patients, and I'm really happy that we have coming on board a nutrition intern in our practice, actually, who will help to formalize this for us, actually. So I think always looking to what is a good foundation for nutrition, what is a good foundation for good mindfulness. We recommend a lot of mindfulness or meditation apps. We recommend nutrition resources, of which we're trying to put together our own. And then we look at how do we support the healthy metabolism of estrogen in our bodies. And that may be through, again, support with indole-3 carbinol or DIM. That's just for an example. We also look at how do we support the immune system for our women who have human papillomavirus. Actually, there is good medical data that shiitake mushroom extract may help to clear the virus, actually. So we begin to talk to the women that we help about using something like shiitake mushroom extract. We also look at vitamin levels, and so somebody can ask that they just have their vitamin D looked at. Low vitamin D levels are associated with a significant number of issues in women. So looking at vitamin D levels, looking at B12 levels. We do a lot of work also with teas in the practice now. This is a somewhat under-recognized area of getting in herbal types of remedies a little bit more safely. And so we begin to look at things like other types of teas for specific issues. So in terms of I can't recommend, there's not one resource that I can recommend. We're actually working on that right now to compile that. If you look on our website, you're going to see a tab called Educate on our website, and it's going to have a guide to supplements, a guide to natural treatments for PMS, or a guide to natural treatments for PCOS, or a guide to natural treatments for hot flashes or endometriosis, because we're trying to put these protocols and help to put these protocols together.
That's fabulous. I will link that in the group so you can all check it out. I'm excited to check it out. Would you mind telling us a little bit more about repeated yeast infections and bacterial vaginosis?
So it's a very large problem that women have, and I think it's actually very under-recognized, and certainly I didn't recognize it as being as important as it is until I went into private practice 11, 12 years ago and started practicing a more general type of gynecology than I was previously practicing. And women do have problems, many women have problems with chronic yeast or chronic bacterial vaginosis. We tend to treat it with multiple rounds of antifungals or antibacterials. You use an antibacterial, then you get a fungal infection, then you use a fungal infection, and then the microbiome of the vagina is out of out of balance. So I think we are beginning to talk about the microbiome of the gut, which is important, and also important to the microbiome of the vagina, but we need to talk to them about the microbiome of the vagina. So our goals when we have somebody who has one of these chronic problems, again, back to nutrition, limiting sugar exposure, good healthy nutritional habits, a good oral probiotic or even a vaginal probiotic that we use. And then we begin to look at how do we reestablish after we treat an offending bacteria or fungus, how do we treat and get the vaginal microbiome back in good shape so that this does not become a chronic problem. And we use remedies that are related to decreasing the pH of the vagina, to giving a more healthy acidic pH to the vagina, restoring good lactobacillus to the vagina. So again, we work with probiotics, we work with vaginal pH manipulation, we work with nutritional and lifestyle recommendations also. And I think what happens a lot of times is here, take this antifungal, take this antibacterial, but we need to really look at how do we consolidate after we treat with those antifungals and antibacterials so that the problem does not become a recurring one.
Thank you for breaking that down. Is there more information about both that and all of the holistic approaches that you take in your practice on your website?
So what we've tried to do on our website is we have a tab called Educate, and Educate is what gets me in trouble every Sunday with my family, because I'm usually on my computer writing on Sunday afternoon. And so what we're trying to do is we're trying to put together a resource for women. And we're trying to put together a resource so that women can find out what are the allopathic remedies for something, and how can you shore up those allopathic remedies with more naturopathic and lifestyle approaches. So we're beginning to try to really write that in a formal fashion so that women do have a resource to look towards, so that they can look for natural treatments for menopausal symptoms. They can look for natural treatments for polycystic ovary syndrome. They can look for natural treatments for endometriosis and such. And we have a number of topics that we explore, and each time a patient comes in and I need to make some more recommendations to her, I start writing them up and try to put them on the website and update it on a regular basis.
That's fabulous, thank you. And again, we'll post all of that information in the group so you can check it out and benefit from all this important information. What are some common symptoms that patients come in around their sexual health?
I think one of the largest complaints in terms of sexual health that I have in the women that I help to take care of too is pain with penetration, vulvar burning. The other is lack of libido and lack of orgasm. Actually, a lot of women who are on birth control pills will actually have a lower libido and a lower ability many times to have an orgasm. And I think it's younger women have a harder time speaking about that sometimes, and so that we try to ask the women that we take care of, we try to ask them about their sexual health issues, to ask them proactively, are you having any issues, any concerns? Of course, with our older group of women that we help to take care of, as vaginal estrogen levels start to taper off, and estrogen levels in general start to taper off, they may have more painful intercourse due to vaginal dryness. And as androgen levels taper off, they may have more problems with libido and issues with orgasm. But in our younger group of women, these are our group of women that we also try to proactively ask if they're having any issues with painful intercourse or difficulty with orgasm or libido, actually.
When a patient comes in who's experiencing low libido, painful sex, pain with intercourse, what are the next steps that you help them with? We, again, starting with what is going on in the mind. How are your relationships? How is your stress level? How are you processing stress? So that, again, is where we begin. We then begin to look at physiologic issues. At the same time, we look at and try to evaluate any type of history or issues with sexually transmitted diseases, any forms of previous pelvic issues or previous problems, any problems with pelvic pain. We then will also, again, we will move to imaging to find out, to make sure that there is no mass or any type of pelvic anomaly or an anatomical issue. And then we begin to treat what we find, basically. And so
we start again though with what's going on in one's life, and then move into more of the physiology after that.
And you touched on STDs and STIs. Can you tell us a little bit more about those, how they play into pelvic pain, where those conditions can present certain symptoms?
So when one has a highly clinically presented, right? So they have a raging infection, whether it is gonorrhea or chlamydia. It's fairly obvious to a clinician what is going on, but it may not be obvious to a woman as to what is going on. Pelvic pain, abnormal vaginal discharge, many times mucopurulent in nature, which is yellow in nature, will be an indicator that there's a significant pelvic infection. When a woman has a pelvic examination, it will be very painful, actually, if the cervix is moved. That's something called cervical motion tenderness. And what that movement or the cervical motion tenderness is that there's inflammation of the peritoneum or the lining of the abdomen. So you're pulling on that lining of the abdomen, so it's irritated. So that will be unfortunately, extremely painful. So those are the significant pelvic infections. The more subtle pelvic infections, actually, that go under-recognized, that may linger and brew for a while before they're diagnosed, actually may be a little bit more difficult to diagnose, or maybe a little bit more difficult for a woman to realize that there may be an infection. There may be some abnormal vaginal discharge. There may be some occasional painful intercourse. Interestingly, with some of the organisms, they'll actually just present with urinary frequency or painful urination, so that a woman always needs to pay attention to that and get some help with it, and get a diagnosis or a cause of that issue. Of course, for herpes, which is a skin infection, we'll see ulcers or pain in the vulvar region.
Can you share with us some success stories of patients that you've worked with?
Oh, fortunately there's a lot of great emails and texts that I get. It's actually the greatest part of being a doctor, when you see somebody who's having a problem, and then you're able to actually help them get a solution to the problem. I think there's two that I'm just like, obviously, that make me smile when I think about them. One was a young woman who I saw recently who had problems getting a diagnosis for pain and bleeding, and we were able to get her a diagnosis and get her treated. And she actually had a significant malignancy, and I just saw her back in the office recently doing well, and she just got her life back. And she's out working and just got her life back, and that was just great to see. And I think that's the theme of the next patient, actually, is getting somebody's life back. I think is the greatest success that you can see as a physician and a surgeon. And recently, again, another young woman came in who had endometriosis that we helped, and she said, "Thank you, I have my life back." And so I think just getting somebody back to their baseline life is that's the success in what we do, and that's what I think probably keeps most of us going each day.
Thank you so much for sharing that. Where can we find you?
I'm on the Upper East Side of Manhattan, on 81st Street between 3rd and Lexington Avenue. Pretty much 24/7, 7 days a week. We're always there.
And can you tell us about your website?
So our website is hopefully an educational one, actually, and we're always writing, and hopefully getting it a little bit more formalized in the future in the form of, I think we're going to call it Balanced Women's Health. That's what we started out with 11 years ago, when this just popped into my mind. And working with some new people, I think we're going to really formalize it. So it's a website where, again, if I see something and I need to make a recommendation to a patient, instead of making it to that one person, I try to put it on the website so that we can make it to everybody, so that everybody has access to see if it can help them with their health also.
Awesome. Thank you so much.
Thank you. Thanks for having me.
Thank you so much for joining us. Now I'd like to hear from you. Please share with us one takeaway from the interview in the comments below. Give us a like and share this group with someone who you think will benefit. Thank you.